We have some really troubling news. We wanted to make sure you guys also had a segment here for the weekend. Let's put this up there on the screen, which is that opioid deaths, U.S. deaths, overdose deaths, have hit a record 93,000 during the pandemic. So just so you guys know, that is a 1/3, 29% year-over-year increase from 2020 or from 2019. This is really just a disaster, Krystal, because fentanyl was actually involved in 60% of the deaths that were last year, according to the CDC. And also, this is one of those places where an honest conversation around lockdowns really never occurred whenever it came to overdose deaths. We talked a lot about it on Rising. I forget the name of that excellent journalist that we once had on, Beth or something like that?
Beth Macy, yeah.
Yeah, Beth Macy, who was telling us anecdotally that the deaths were just completely out of control whenever it came to opioids, and there was not a lot of reporting around this. And I saw how economically screwing with people's lives was really beginning to have a toll, because I saw reports of people who went on unemployment, then went back to a job. The moment they lost their job again after the second lockdown, 2 days later, found dead in a bathroom. You know, it's like, and this happened over and over again. A lot of people, the social isolation, a lack of ability. Look, I mean, an AA meeting or an NA meeting is just not the same fundamentally on Zoom. And that really is what caused, it's not just opioids, like I don't want to single them out. Alcohol use is way up. It's like 40 or 50%. Marijuana use is way up. Pills are way, like in general, people are turning to mind-altering substances after a year of social isolation. And the level of anxiety and the level of depression and more is high. Suicide, interestingly enough, actually dropped. It didn't necessarily rise at the same rate, but the overdose death rate is one that we have to reckon with, the cost to millions of people. Because remember, it's not just the 93,000 who died. Every one of those people is a child, a father, a parent, a sister, mom. They have to live with somebody who's dead and who's gone now. So I just, I think it's so horrific, and it's a sign of all of the progress that we made is essentially over. And it's just the core ills of what remain in the country. That's what it is to me.
What Beth was telling us when we were talking to her, Beth Macy, and she's based down in Roanoke, Virginia, which is in Appalachia, and she really tracked the very beginning of the oxy and opioid prescription crisis and what that morphed into. Once you can't get your oxy anymore, then you're into street drugs, then you're heroin, then you're getting fentanyl. And the reason that fentanyl is so prominent is because it's so potent that it's easy for drug smugglers. Like you can have, one suitcase of fentanyl is equivalent to a much larger shipment of cocaine. So that's what ends up on the street because it's cheap and easy for drug traffickers and smugglers. And what she said is that doctors who were working with people who were struggling with addiction, during especially the early phases of the pandemic, you'd first be meeting with someone by phone. They're, you can see in the background, they're in a house, they're in an apartment. Then as the sessions went on and the pandemic worsened, then you saw, people who were having to do their Zoom sessions with their doctor, their counselor from their car. And it was just this instability in their lives that really, sent a lot of people over the edge. It's horrific. The other numbers that we looked at is, number one, it wasn't a lot of new people struggling with drugs. It was people who already were struggling with addiction who ended up being part of these statistics by and large. And then the other piece is, the opioid epidemic, it really started in these working class, mostly white communities in Appalachia, which actually it's interesting. Part of why it was more white people who were prescribed the drugs is because there was this latent racism among doctors where they thought the white people could handle it without a problem, but they were less inclined to prescribe to Black Americans. Well, during the pandemic, it was, it was the lower classes of society that were hit the hardest by the pandemic. Disproportionately Black men make up that group, and they were also the hardest hit in terms of the number of increases in overdose deaths, which is being tracked as well. So just a horrific state of affairs. And one of these signs that we look at in society of you see these top line numbers of whatever the stock market's doing and whatever the GDP growth is and all of that. But these are the most basic metrics of how a society is performing. Are people living or dying? young people overwhelmingly, their mortality rate is increasing, and it didn't have anything to do with the pandemic. So I think you're right that there was a lot of, I still think if you look on balance that the right thing to do would have been to shut down the economy, but keep people attached to their jobs to make sure that they had predictability, because that's part of it too, is it was so haphazard that people had a lot of stress and anxiety in their life about whether they're going to make it. You have a lot of people at the bottom of society who fell through some of these safety net programs, who couldn't get on unemployment, who didn't receive the stimulus checks, who were still kicked out of their homes, as we talked to Jordan Sheridan about, even though there were technically these eviction moratoriums in place. So, on these basic metrics of how a society is doing, we just see these gigantic failings where so many people are so miserable or so hopeless that they end up as part of the statistic. It's just really sad. And some progress had been made. If you look at a map of the states, I think we have a map of the states maybe, and which states had the greatest increases in terms of opioid deaths. I think there was only one state, it was like South Dakota, that actually improved this year, and their numbers, it's a small state and the numbers were small to start with, but overwhelmingly in state after state after state, this is the trend that we saw.
No, you're right. And one thing, just again to the lockdown point, which is that there was a lot of wish casting. And actually, James Hitchcock, let's put his tweet up there, found this. Back in June of 2020, the Washington Post had an entire op-ed which said that there's Trump's pet theory about the fatal dangers of quarantine is very wrong. Okay, they specifically say we should not scare ourselves with nightmares about tens of thousands of additional suicides or drug overdoses. Well, they got one half of that equation correct, which was the suicides, and the other one completely and totally wrong.
People just don't want to be honest.
Be honest.
You have to be honest about the fact that, of course, there's going to be consequences when you shut down the economy like that. And that doesn't mean that on balance it wasn't still the right choice to make sure that people didn't die from the pandemic. But there was a cost-benefit analysis here that no one really wanted to be honest about. The people who were anti-lockdown only wanted to look at these numbers. They didn't want to. They wanted to pretend like coronavirus is no big deal. It's just a cold. Right. It's fine. Don't worry about it. You can take hydroxychloroquine or whatever, and you'd be totally fine. And people who were in favor of the lockdowns, they didn't want to talk about the increase in depression, increase in suicide, increase in drug overdoses. They didn't want to talk about the impact on children, which, again, the most disadvantaged kids are going to be the ones who are set back the most by a year of online school, and in neighborhoods where they may not have reliable internet access, where they may not have a family member who can be sitting there with them and and basically homeschooling them. I mean, that's a massive burden to put on any family, let alone ones that are struggling to get by and just keep body and soul together month to month. So I think you're right that there was never a really honest conversation to be had by anyone about the cost and benefits of these lockdown procedures. I
think that's very clear in this, and I really feel for a lot of the people who've been affected by this. I really do. Okay, guys, we're going to have more for you over the weekend and more. Stay tuned. We'll see you later.
Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut, our reactions to each other's monologues. You get to listen to it. You get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.